these guys, I've been a big fan for a long time. They've been part of Startup Health since 2013. So, but you guys have been building an amazing company. I'm, as I said, huge fan. And let me just steal the punchline here. 30% of the doctors in the US are on doctor.com. So they have had tremendous progress over these years, and I'd love for you to tell us all about it. How would you describe doctor.com and what you've built so far and the challenge you're trying to solve?
First, I think it's worth noting that Startup Health has been very helpful in this whole journey, and just wanted to thank you guys so much for having us here and having us in the community for as long as we've been here. You still tolerate us.
It's our pleasure.
Absolutely, yeah, thanks. Happy to be here. So to answer your question, doctor.com is really all about helping organizations manage consumer-facing physician data at scale across the whole healthcare ecosystem. So to kind of unpack that, when you think about what is an essential ingredient to having a modern experience for anyone who's trying to find care online, whether they're in an insurance directory, whether they're on a site like a Healthgrades or a Vitals or Google, whether they're on a pharma brand website that they arrived at after looking at a campaign. In all of those cases, it's really critical that the physician data that shows up is accurate, is compelling, tells a story of not just who works where and when they work there, but what they're specialized in, what they do best. And kind of shockingly, right now there does not exist a single source of truth for this information. There does not exist a system of record where it lives. And we see that as a really awesome opportunity and a very big problem that's very worthy of being solved.
So how have you been doing that? Tell us about what you've built so far.
Sure. So we have built a couple things. One, we have built a system for managing physician data that can ingest data from pretty much any source, normalize it, enrich it, and then probably the most interesting part is we can then push that data out where it needs to go. So we have what we call our partner network, which consists of a lot of very large names that folks know, Google, Microsoft, Apple, all partners. Also, as I mentioned earlier, the Healthgrades, Vitals, WebMDs of the world, many, many brands that people are familiar with. We've built connectivity directly into the databases of these different sites and these different ecosystems so that if a physician in our platform needs to change a phone number, needs to add a photograph, needs to talk more about maybe a new procedure they're offering, they can do that one time in one place with us, and that gets reflected out across all of those different consumer entry points.
Mm-hmm. I mean, that's really critical. If you guys think about, as consumers, your experience when you're trying to find a doctor, find information, there's so many different places you can go, and the information is not all accurate. And then as a doctor, if you go from one health system to another, you're screwed without something like doctor.com helping you, make sure that everything is correct. So from multiple angles, what you're building is hugely valuable in terms of just the integrity of the data that's out there. So I think that's amazing. So the amount of data you've been collecting is kind of mind-blowing. So you can talk to us a little bit about that. There's so many opportunities and directions you can take that. So maybe share a little bit about your data strategy.
It's actually been one of the most interesting things about getting to scale is the fact that there are new opportunities every day with different kinds of institutions who, like Andrei said, have some reason to represent doctor data to a consumer in an environment. So in 2018 and 2019, we started working with all kinds of new institutions who have those needs. If it starts with the hospital itself who runs a doctor finder, it expands out into the payer who needs to represent to their members who works where and what they do. Mm-hmm. It then became interesting to pharmaceutical companies who require their doctor finders in order to direct that patient to the right kind of place to learn more and perhaps receive their prescription. It's also being used by patient financing companies. It can be used by medical malpractice institutions. We've decided to start working with the kinds of companies who are horizontal in nature but have healthcare as one of their elements. So for example, we just announced today a relationship with Podium. So Podium does an amazing job helping small businesses engage with their customers and make sure there's enough feedback from those customers on the web for new customers to decide to come to them. So Podium chose us to partner with them and help make this truly horizontal solution something that's healthcare specific. Really help them attack that vertical. And we just see like a wide variety of opportunities here. If you yourself in the audience operate a horizontal business and want to get more healthcare, maybe one of the reasons you're here at this show, or if you're a healthcare company who's looking to be able to do more with the doctor data maybe you're collecting, we're an amazing throughput to try to get that out in front of consumers all over the web.
I mean, I think it's really interesting when you talk about all the different types of organizations you partner with, and startups often in the early days, there's definitely an exercise of figuring out who your target customer is and maybe who your secondary customer is and whatnot. And at this point, it feels like there's no one in healthcare you can't partner with because you're becoming this ubiquitous layer across, driven by these provider directories, but you can really add value across the board. But was there a tipping point in your business where you kind of felt like that threshold was unlocked after you got so many providers on the system? Or maybe talk about that development of being able to work with so many different verticals, because I think that's the dream of a lot of startups, right? Like, oh, who wouldn't find this valuable kind of thing?
I know I have an answer here. I'm not sure if you
No, go ahead.
to start with. So I really think in many ways the tipping point was when we had created this landscape of pipes that connect our data to all those consumer-facing outlets.
Right.
As soon as you have the opportunity to work with partners like HealthGrades, who's been just an amazing partner to work with, you get this opportunity to represent for new partners and new institutions all the different things that their data can do and all the different people who can see it. And I think the tipping point was really just about scale. At some point, we got above 200 hospitals using our platform as the system of record. And once you have that many providers, there's just, everyone can see the opportunities. It becomes really clear.
Yeah, that's really phenomenal. So then, talking of opportunity, how big do you see this going? What is your ultimate dream for Doctor.com, 5 to 10 years from now, in terms of being ubiquitous and being this layer that's powering so much? What could it look like in your wildest dreams?
It's a great and a very startup health question, so I appreciate it. I think when I answer this question, I actually sort of like to use an analog. So I'd be curious, like, show of hands here, who booked their travel online to come to this event? Right, okay, probably a very large majority of people. I think the travel industry is fascinating and actually has a lot of similarities to healthcare. Similar in size, both I think over $3 trillion industries. And when you look at travel and you look at not so long ago, there was a booming business within travel of travel agencies, right? These are people that you'd pay lots of money to do your travel booking for you. And the deliverable would be this dossier of maps and confirmations and tickets. And I think most people under the age of 30 actually don't even know what that is. Have never used it because that industry modernized and evolved to the point where it became just seamless to do it all online. I mean, I booked a 2-week family vacation to Japan in about an hour on my phone a year or two ago. So when you think about an industry like that that's gone from being so hard you needed to pay help to being magically simple, and the fact that when you book a hotel online, you don't worry that hotel is actually closed 3 years ago and you're going to show up at a vacant building. When you book a flight, you don't worry it lands you at a different airport than you booked. Unfortunately, healthcare is where travel was 30 years ago in terms of the underlying data quality. So when you think really big, you think about the ultimate opportunity that we have to do something transformational, it's to build the layer that was created in the travel industry, the central infrastructure, with GDS services, other things that effectively connect the supply and demand sides of the market so that there is a source of truth for all of that data that lets every single travel site have the same pricing, the same photos, the same very reliable data you trust. That should be done in healthcare. And so that's what we're building. We're building the central infrastructure that sits between the many different silos that have physician data and the many different consumer entry points where people go to find care. And we're bridging those two things together. We're enabling transactions on top of that. And we're making sure that it can be just as trustworthy to find, research, and ultimately book a medical appointment online seamlessly as it is to book a hotel or book a flight.
That's really exciting. I mean, I think that's been a theme with a lot of the talks on stage here over these 2 days. And it's something we've talked about for years at Startup Health, which is just the demand. People are expecting more and expecting better, when it comes to healthcare because of every other aspect of life.
Absolutely.
Things work better. You have more control over your information and you have more trust and things like that. And there should be the ultimate trust when we're talking about health, because it's obviously life or death. And so the theme of this event is around collaboration. So as a sort of final question, is there one, and collaboration is your whole business model, right? You partner with everyone. I don't think people realize when you Google a doctor, it's powered by doctor.com, the results. You've really collaborated with everyone. Is there one collaboration that's been kind of transformative for you, that was kind of the most transformative, and is there a dream partner you haven't yet collaborated with that you'd love to?
Well, I think we'll reciprocate a shout out we apparently received earlier, which unfortunately we weren't in the room to appreciate, from our good friends at Novartis. And so one of the areas we're most excited about recently expanding into in terms of where we're now connecting our data assets and leveraging our provider finder technology is in the life sciences space. And I am very, very grateful and appreciative to the whole team at Novartis who, when we were just beginning to explore this space, leaned in and through Startup Health as kind of the connector of all of that, leaned in and gave us what began as a small pilot to prove that our technology could be leveraged to help them deliver a more modern consumer experience on their branded and unbranded sites, their consumer-facing sites. And that's now just continuously expanded and grown from there. And we're optimistic we'll keep doing so in the years ahead. And so that's been a really profoundly impactful partnership for us, not only because the team there is phenomenal and so supportive of innovation, but also because it really helped us understand the ultimate opportunity in the life sciences space, and we're doing a lot of things specifically in that vertical to innovate and meet their needs. So I'd say that was a big one for us.
I think I'd also sort of turn your question into a question. Like that Novartis opportunity wasn't a surprise to us exactly, but it wasn't where we had envisioned taking the Doctor Finder. And so the question is actually kind of for the audience and the people that are listening, which is if you can think within your own sphere how provider data, how provider search, and how those kinds of transactions can help you evolve your business, come and reach out to us. There's so many ways that we can figure out how a positive opportunity can be born from an initial conversation that we're always open to having them.
If it's not clear, Reed runs business development.
Yeah.
It's true. That's true.
That's right. He's open for business.
Yeah.
All right, guys. Well, this has been a pleasure and really proud of both of you, what you've built. You've been a fantastic organization, and I can't wait to see where it goes. I know it's only going in one direction, and that's up. So thank you.
Right back at you, Katya. Thank you.
Thanks so much.